There is an urgent need for minority blood donors right here in central Indiana.
Local doctors say the percentage of African Americans who donate is alarmingly low. WRTV's Nico Panisi live this morning with this story. Nico?
Yes, good morning. I'm here at the Indiana Hemophilia and Thrombosis Center, one of the largest treatment centers for bleeding disorders in the country. Doctors here say they need your help. If you're to receive a donation from a donor who has different antigens than you, your body may see it as an invader it needs to fight off. Folks with similar ethnic backgrounds have similar antigens. So, for example, as someone who's Hispanic, if I were to receive blood from someone who is also Hispanic, my body is less likely to reject that donation, causing less complications after a potential transfusion.
Hello. Hi, how are you?
Tanisha Hackett has been living with sickle cell disease her whole life.
Perfect.
She's a patient at the Indiana Hemophilia and Thrombosis Center.
In my lifetime, I've had several crises, sickle cell crises.
SCD runs in her family. Her oldest son also has the trait. She says when she falls ill, she can rely on them to come to her aid.
My husband is very supportive. I've educated him on it. He's also so open to learn about sickle cell disease so that he can help when I go through a crisis pain.
When that happens, she experiences severe pain in her limbs or her neck. Sometimes these spells can even last 5 to 7 days, and she says they're debilitating.
Whenever we have a sickle cell crisis or severe pain, oftentimes we need a blood transfusion.
Sickle cell disease disproportionately affects minority groups. According to the National Library of Medicine, about 1 in 500 African American children and 1 in 36,000 Hispanic American children are affected.
It's not enough just to have a letter type. When you're a minority, you have antigens in your blood, and we need those antigens match up with our blood better. So when we need a blood donation, then the body tends to accept the antigens from a minority versus a non-minority.
But there's a problem. In Indiana, only about half of 1% of donated blood comes from Black Americans. Carlene Heater with the Indiana Hemophilia and Thrombosis Center says people of color may be skeptical because of misinformation surrounding blood donation.
There's a lot of myths. People are afraid. They don't know what are they doing with my blood, or it could be because of, in the past history, the different things that minority went through.
Heater encourages folks from minority groups living in the Indianapolis area to consider donating. You could help patients like Hackett.
It's not just for people my age, but from babies to elderly people, and that you would just come out. We really need your help.
And September happens to be Sickle Cell Awareness Month, and in honor of it, IHTC is hosting a minority blood drive this Saturday. We'll have more information on our website, WRTV.com. Reporting live, Nico Panisi, WRTV.